Since the film was completed, we have been facing a new challenge. That is in form of COVID-19 pandemic.
It was a big adjustment, really a big adjustment. We had to close so suddenly, and so we have all these patients that had appointments. So the charts had already been pulled. There were stacks of charts of patients waiting to be seen. So what we did is we kept coming in. We didn't miss a beat. We came in and we went through every chart of every patient that had an appointment that wasn't able to come in, and we called them, and we've started doing telemedicine.
So Michael?
Yes.
Hi, this is Shar. I'm calling you back from the Noor Clinic. I'm going to follow up on our visit from last week, and again, I want to deeply apologize for not being able to have you come into the clinic.
So we're doing real medicine. We are continuing on.
Mi esposo el lunes cumplió un año que murió de cáncer. Es por medio de internet lo encontró señora Marina y me explicó porque me dice no cuento con un seguro. Fui al hospital y tengo una cuenta de como $9,000 o $10,000. Y yo dices, wow.
I went to Africa. It's one of the poorest countries in the world, Mauritania. 5 million people with limited access to any kind of health care facility, infrastructure. People there and people here are exactly the same. Not being able to see a provider. You don't have it, you can't afford it. What's the difference? You can't see somebody, right? You know, this is just really sad that the poorest nation in the world faces the same crisis as the richest nation in the world. We have option to do something about it, we don't do, but they have no option to take care of their people.
I'm here because I needed to do some follow-up on a condition I may or may not have, and I don't have insurance because I work for a nonprofit. I work for a charter school. I heard about this place through a friend and it sounded too good to be true, but it turns out it's a LifeSaver.
I can't afford Medicare, and so coming to Noor has been my health care.
I'm retired, and financially I can't afford dental insurance, and this is my savior. I'm also a vet, but the veteran really don't offer dental anymore either.
I'm single. We don't offer insurance here just yet. We're still pretty small.
Healthcare should be accessible to everybody. Shouldn't matter how much you make or how much you can afford.
What would you do if you didn't have the Noor Clinic?
What would I do?
Yeah, I mean, where would you go?
It'd be very difficult for me to go anywhere because of my standard of living. Yeah. Seems like as a person gets older, it's getting difficult to maintain work.
With no dental insurance, and I'm just a little old waitress serving tacos in a restaurant, little old grandma, and my teeth needed major help.
I was working as a carpenter. I was working in the trades. I was using, power tools and climbing high things, and I had no insurance, and I had 2 kids.
There's a lot of really great, hardworking people in our area, across the country, that don't always get the care that they need, and they're sort of forgotten people in many respects.
I needed some help,
I can't afford insurance, even though I get fined for not having it. And I make $200 a year too much to get Medi-Cal. I think like a lot of people, I've fallen through the cracks.
I had no idea that it was this bad in this community. And this is a really affluent community.
I didn't think I'd be in this position, or I didn't think I'd be someone who would use a free clinic, frankly. Like, I thought, I'm educated, I have a job, and I can take care of myself. And the reality is that's not the case. I can only imagine who else is accessing this clinic, and that it's diverse, and they have diverse needs and stories and reasons why they're here.
Our patients look just like you. They're 20-something who are trying to pay rent. They're off their parents' insurance. They're working part-time because employers don't offer benefits. They've got families. They've got 4 kids. They can't afford the Affordable Care Act. It's got too expensive. They're in their 60s, but they're not 65. They're having to go back to work when they never thought they would. They can be immigrants from another country who have come for a better life and don't have any other options when it comes to health care. We see the community. We see everybody. There's no specific set of criteria that puts you in a place where you're assured health care. You can't figure that out. You know, I fit into the profile of, hey, this guy probably has always had health care, and I haven't.
This is everyone's clinic, and that's both the sad reality of our community, is like we don't have other healthcare options for many of us, and a really important reality that Noor is here to fix that.
A doctor from Afghanistan and myself, a doctor from England, started this clinic.
I was 12 or 13 when we left Afghanistan. You know, it's a process of going through smugglers, and people get you across the border, and you're not sure you're gonna make it, or you're not sure that you're gonna get caught by police. You're not sure if you're gonna, the bandit is gonna, rob you. You're not sure at all. They just fake. You pack your stuff, a bag, and then you leave. You leave everything behind.
So why did it start? I mean, I think we both have a little bit of a different perspective. I think most doctors who get out of school are really naive about what the real medical world's like. I think we all go to school to help people and with this altruistic feeling, but then you get out in the world and you realize that business and insurance and payers and third-party payers, and it's a business, and they're people who can't afford it don't have a lot of options.
Medicine has evolved into a corporate entity, and it's difficult when you're looking to do the best you can for patient care while working on a tight timeline.
Part of who I am and who my culture is and how I was brought up by my family. They're a big influence on how I do things and what I was taught as a kid, to be compassionate and do what you can for your neighbors, for your family, for your friends.
I've always been self-employed, basically, and I did have a job back in 1985 where I had health insurance for a year, but my whole life I've never really had a regular family doctor or any such situation where my health could be really taken care of, and I just ignore it because of the financial cost.
First and foremost, unfortunately, is there's a population that does not get care. I mean, period.
I think a lot of people unfortunately go without health care because it almost has, it's become a luxury.
It's a decision on what they spend their limited resources on. Do they spend it on food for their children or school books for their children, or do they spend it on medical services?
The one goal at Noor is to take care of patients that can't get care elsewhere. That's access. One of my colleagues says the best thing to do, the most efficient healthcare, the least expensive healthcare is at the right time and at the right place. And that's clearly primarily not in the hospital setting.
We have the best of everything. Best surgeons, best doctors, by far. But we're not doing enough in a preventive end of it. How are you going to have preventive services if you don't have insurance? I mean, it's simple. How are you going to take care of yourself if you can't see the doctor to begin with? So we spend so much more money than any other nation just by that fact, because we take care of everybody afterward.
As an emergency responder, anywhere, you're going to see tons of people that fall through the cracks of the healthcare system. You see genuine emergencies, but you see a tremendous amount of people that are calling 911 because that's their only access to a doctor. And that is not the correct way for them to enter the healthcare system. And it's a complete waste of resources, and it's also not giving the patient the best care that they could get.
In the last 3 weeks, every half day I've worked, there's 1 to 2 ER visits that could have been taken care of in a clinic, but I think because of lack of access that's their only option.
So what's the best way to take care of unfunded patients from the hospital's point of view? Don't have them come in. And what's the best way not have them come in is provide them health care in a place like Noor. And what Noor does is it treats pre and post hospital, and in general, those patients that have no access to care under the normal circumstances. Is that wonderful for patients? Absolutely.
The other thing that people don't realize is that emergency rooms cannot discharge people unless they have somewhere to land. In other words, you can't just take Joe Smith who comes in with a problem and say, okay, sir, you've got 220 over 180 blood pressure, here's some medication, see you later. You, by law, have to have somewhere for them to go for continued care. So guess who serves that role? We do. Because that person, if they got to pay for an office visit and medications, they're not going. So we're that place for them to land too. So the emergency rooms love us.
As we keep hundreds and hundreds, maybe thousands of people out of the emergency room. And don't kid yourself, we all pay for emergency room visits, even if the patient doesn't pay. It goes into our healthcare, cost of healthcare. So we're keeping down the cost of healthcare.
So this is why the Dignity has financially supported Noor as one of its grantors on a yearly basis, because it's the right thing to do to provide health care to our population that does not have access, and it's also financially appropriate for us to do as well.
I came here 2008, right after I graduated from a residency program in Atlantic City, and I work at Sierra Vista and French Hospital as a hospitalist, and they all share the same common fact that they didn't have insurance, they haven't seen a physician for a long period of time. When they do come in, they come in with a bunch of problems.
Having been in practice for 30 years locally, you just see every day hardworking people go without, and that's just hard to stomach. If you know you can do something about it, if you have the skills to do something about it, how do you not?
So that was the beginning of the journey. I said I need to do something.
We all complain. It's what we do, right? But I thought to myself, it's okay to complain, but what if you did something about it? They always say you're either part of the problem or you're part of the solution. And I wanted to be part of the solution.
So the first time I met Rupert was in Sierra Vista Hospital. I was giving a talk about the clinic. It was just the beginning of the clinic. I want to open a clinic, and we got a bunch of audiences, and I see this guy with glasses sitting there exciting like a kid in a candy store. And so we talked about it, and all of a sudden he raising his hand, he asking a million questions, and he's just so excited. I mean, I haven't seen anybody this excited. I was like, this guy is really weird. He must be, because, you know, who gets that excited about, you know, it's just a free clinic.
The Noor Clinic was the first one, and I'd never been sick. Never had anything wrong since the early 80s. One of the things that the doctor had me do was get blood work. And by accident, they found out that I had Hep C.
And when I walked in, I'm like, oh, we have a positive Hep C. And you're like, yeah, I guess I'm just gonna, I remember you saying, I guess I'm just gonna die with Hep C.
Without the help from here, I probably would be dead.
I would bet that a lot of the people who spend time at Noor have changed feelings about what our responsibility is to our society as a whole. During this very difficult political climate, I think spending a day at Noor is a very valuable life lesson.
Well, I'm going into my doctor's appointment, and I'm really excited because I haven't seen a doctor in about a year, and I have some questions that I'd really like some physician support with, so I'm really, really grateful I get to go in here and have this service. Hi.
Do you have an appointment today?
I do, at 9 o'clock.
What's your name?
Olivia.
And just to be clear, you don't have any insurance, right?
No, I don't.
Okay. And you're all set, okay? They'll be right with you in a little bit.
Thank you.
Yeah, you're welcome. They are surprised. They just don't believe it. They think, why is it free, or, you know? And it's just, we like to help people out, and that's why we do what we do.
But it was really interesting at first how people just could not accept that it was free. You know, we got a lot of pushback on that, and we're like, and then after that, then it became, okay, if it's really free, well then, how can I pay it back? That was the next thing we got for the next several years, which I thought was a beautiful exchange. You know, how I'm a painter, so can I come paint something, or I clean houses, or can I come clean the clinic at night for you guys?
Why are you allowing me to stick this camera in front of you?
Because I'm very thankful and indebted. She won't let me do her landscaping. Tried to go around her and get her husband's number so I could help him somehow. But that's against ethics, I understand. So this is it. Something I can do.
Gracias a ustedes, mi esposo está bien, de veras.
Es un placer. We were actually able to get him into a study. So Dr. Stanley from the California Retina Consultants does research, and some of this treatment's very, very expensive, but we were able to get her husband into a study, and so therefore he's receiving all this treatment for free on an ongoing basis, which in essence is saving his sight. So we have great partners out there in the community that help us with the more difficult cases, and so we're very grateful for them as well.
Dios, yo le pido mucho por ustedes que les dé la magia en sus manos para curar a las personas a través de Dios y de sus manos.
I'm Latina, and I'm helping my community is helping my family. We're getting many Hispanics or Latinos coming in, especially nowadays with the situation in the news about illegal immigrants, and so they're coming in afraid. They're coming in more skeptical because they don't know if their information is going to be given. I feel that they feel that this is a secure place for them, and they're always so thankful, like after the exam. And first they can't believe that it was all free, and then they're just so thankful that there's a place, that there's still a place here that they can go and feel welcome.
They always tell us that we treat them with respect, very different from other clinics, and that we show that we care. I've had patients cry in front of me because they're so thankful.
I'm really blessed with this. Yeah, I'm feeling so grateful, and God bless everybody here. Yeah.
Healthcare can be a very political topic. It seems that everything today People are on one side or the other. No matter what your political persuasion, you generally support the Noor Foundation.
As a county, it's our responsibility to help take care of what's considered indigent health care and welfare. And so people who really have nowhere else to go become essentially the responsibility of the county. And it's very expensive, and it's not an easy task to do. So being able to expand, you know, our partnership with a free clinic like this has been really something that I don't think anybody could have imagined doing on their own, certainly.
I mean, and I'm a conservative, right? So I talk about it all the time, but even from a financial standpoint, just the basic budgeting, it makes so much more sense for County of San Luis Obispo to support the Noor Foundation than it does, to be able to set up something on their own. Noor Foundation is successful in our community, and we should do everything we can to support it.
Everybody liked the idea, saying, great, that's a great idea, but you're crazy. That's not gonna happen.
When Dr. Nooristani came to me originally and talked about having a free clinic in San Luis Obispo, I said to him, you're crazy. Putting something like that together, getting sponsorship, getting coverage for that in this healthcare market is absolutely ridiculous. Well, he took my statement, put me on the board, and here we are.
I thought it was crazy. I thought it was a crazy good idea, though. And I just had gotten laid off from my job I had for 15 years. And I was talking to my sister who works for Dr. Chowins at Pacific Eye. And my sister said, well, Dr. Nooristani's opening up a free clinic. He needs somebody to put the clinic together, buy the equipment, and that's what I did at my other job. So I talked to him, and the next day I was volunteering for him.
As a physician, I said, where's the big deal? I'm gonna open an office, it's a free care. I'm not charging, I'm not getting paid. People are gonna see me for free. I mean, how hard could it be? I mean, it just opened the door and people come. But you realize slowly going through that process that you require A, B, C, D, and the list goes on, and so you just take it one step at a time.
When we first started going out to raise money, a lot of people said, look, if you're still around in a year, come see me.
I had come into acquaintance with Ahmad, and we had some conversations about what he was hoping to do, and I thought it sounded great. And it was really just a matter of saying, okay, when you have all of the things that you need to have done, put together to have this truly as a nonprofit and all the commitments you need, come back.
Failing was not an option. And I think when you take on that attitude, any bump along the way is just a bump.
There are times that you look, you say, like, oh my God, it's taking so long and so much effort, how long I'm gonna continue? But then you look back at those patients saying, okay, these people could lose their life. Every day that passes by, you are risking somebody else having a stroke. Every day that I'm not open, somebody else might have a heart attack. Every day that I'm not open, somebody might lose their son. So we went through all the challenges, and it just took about 2 years. And then we were able to open after 2 years of non-stop work. Nooristani means literally land of hope, or land of light. And the Noor part obviously means hope or light.
Our opening day was October 14th of 2011. And it was just me, Dr. Nooristani, and an MA. I had already scheduled all the patients for us that day. And what would happen was he was working as a hospitalist at French Hospital at the time. And so what I would do is I would call him and say, hey, we're ready to go. He would run down, see the patient, maybe have to run back to French Hospital and see his other patient, and then it just went back and forth. It was just me and him on Fridays 1 to 5.
So initial plan was to go ahead and get an office and start seeing patients in the time that I have off or I wasn't busy. But it turned out that this community was very accepting of the idea, and there's a lot of other physicians and medical providers that said, hey, you know what, we were more than happy to come in and help you in that process. We want to volunteer and we want to donate our time.
We have 70 plus or minus health providers at any given time donating their time.
It's a happy place to be and real care because they want to provide the medicine that they went to school for. And I think you can do that at the Noor Clinic.
It's a very rewarding experience, I think, for a physician because your whole thought process is the patient now. It's not, you don't have to worry about the other aspects. You don't worry about the business part. You don't have to worry about any of this. Your total focus is on the patient, which gives you a lot of time to listen to their problems and try to explain in simple terms what's going on and how we're going to treat it.
¿Cuántas veces el cuarto de baño al noche? 1, 2, 3 veces. Sangría, dolor? No.
With Noor, we're working on paper charts, which is wonderful. You can do so much more and have more direct eye contact with the patient.
The doctors here care so much about what they do. The patients that come in here are not numbers, and they feel that. The doctors take the time to talk to everybody, to listen to them. Where, you know, probably in their private practices, they don't have that luxury anymore. You know, they have to see so many patients. And here, I give them the time. I do the scheduling for them. If they want 45 minutes, they got 45 minutes. If they want an hour with the patient, they got an hour with the patient.
Siento como que en la otra clínica era lo más de llegabas, te atendían y no te preocupaban por o porque te duele o nomás era pues tienes esto y ya no preguntaban como qué más puedes tener mejor aquí. Yeah.
Because they are, you know, a free clinic and can be a little more free in what they do, they can dance between Western and Eastern medicine practices and be a little bit more open-minded as far as, you know, a course of action.
She didn't recommend taking any medications right off tops, whereas both my other experiences in the initial appointment, the option of taking meds was presented, and that was not even discussed today. It was like, let's see what's up. Let's look into this.
It's just nice. It's nice to treat patients that they're so appreciative. So instead of dreading going to work, I come here and it's like kind of exciting.
This clinic is sweet, it's real, it's the best care you could ever get.
It's not just a free clinic because a lot of things are free. You can have clinics, but this is really a good place.
Free is associated with the stigma of low quality. I wanted to create something that you come in and you don't feel any different, as if you are going to your doctor plus. We do in-house lab, for example. So if you're here, we could draw your lab right away and get your result in 5 minutes, and here we go. We know about your cholesterol, about your kidney, about your liver, about what's going on right now at this visit, and we can make a decision at this time.
So I had a patient come in, mid-30s, and developed over time some inability to get out of bed and to lose his job, and had been to other clinics and sort of told that it's normal with aging, and for us we were able to tell him that he had Lyme's disease and that it's treatable and it's a condition that does need to be treated.
We provide incredible medical care, but if a person can't afford their medications, then you know, all that good medical care only goes so far. Part of my job is providing medications through the pharmaceutical companies. I work with 60 to 80 different pharmaceutical companies. The good news is that we can get you the medication.
I think a really big tenet when we started it was prevention. We felt like it was really critical that we got these people, you know, before they had the stroke, before they had the heart attack, you know.
A lot of the patients are very hardworking, but they've neglected their health because of finances for many years. They haven't had labs done in a decade. And so they come in and You know, they might be diagnosed with high cholesterol, pre-diabetes. They aren't diabetic yet, but they're in the stage, that window of opportunity. If you look at your plate, proportionately half of it should be all vegetables. And then the other half, you can have 1 serving of carbohydrate. So instead of 4 tortillas, it'd be better if you have just 1. Because diabetes, you have difficulty processing sugar, and carbohydrates are broken down to sugar in your body. Often we talk to them about changing their diet for their entire family, so, you know, for their children. So we're hoping that we can actually impact not just the patient, but their entire family, their children, and the next generation.
El pan se convierte en azúcar. Aunque no diga que es azúcar, cuando tú lo comes, se convierte en azúcar.
So you may want to start with the vegetables. If you fill up with the vegetables, then you won't crave the carbohydrates as much. I think something good's going to come out of this COVID-19, and that we are going to now adapt to the times and develop telemedicine more here in our clinic. And I think it's here to stay. I think it's something that we can really use in our clinic. It's very useful for chronic disease management, especially. Most of our diabetics have glucometers that we've given out for free, so they're able to check their blood sugars at home. And, you know, we ask them to have all their readings written down, and we go over what their readings are. We'll do a 24-hour diet recall, and then we'll make a decision if we should adjust their diabetes management, their medications, or diet.
The last time I talked to you, I asked you if you would go ahead and check your blood sugars and get some readings for me.
Yes.
Okay, so how are you doing with that?
Over the past week, my blood sugars have been coming down.
Good.
Until today, I've been sick, some gastrointestinal issues.
Okay.
And my glucose numbers did spike this morning, but other than that, they've been coming down pretty steadily.
What's interesting is that because we're using phone calls now, we realize it actually makes us a little more agile. So with phone calls, we're able to call them every week until their blood pressure is controlled. Whereas typically with visits, it's hard to get them scheduled every week. It's hard to get someone to come in.
We're doing it just like it's a regular appointment. I mean, we go over all their diagnoses, we review all their meds with them, we see if they, how they're feeling, do they need any refills. And I have to honestly say that these patients, I don't think they're compromised much. They're getting really good care.
The Noor system is unique that we are an all-inclusive clinic. We have access to medical and dental and eye, and we can all coordinate care with that person, which just doesn't happen out in the real world.
So Ahmad and I got together and we go, we're not going to run the dental clinic like an emergency clinic. It's going to be a dental home. So this clinic has regular patients. They don't just come here and get their emergency taken care of. The key is education. Everybody gets educated here on how to take better care of themselves, and it's reinforced at every appointment. It's unique. There isn't any place else that we know of that operates this way. It just is a private dental office.
I found this place, and they have been a huge blessing to me in my life, because my teeth are better now than they've ever been because of the hygiene and all of the dental work that they've done. They've been really awesome here.
I think I got online and I pretended I had a toothache and tried to figure out how I could get it fixed for free. And SLO Noor Foundation popped up on the internet, and I called Ron and came in and started volunteering.
So they've saved my teeth. So it's been a real blessing. You gotta have your teeth. I love to smile. How could you smile if you didn't have any teeth?
I think we are in a very unique situation to help people.
You know, you talked about hitting your, you know, and your head hits the pillow at night, and what do you think about? I think I did good. You know what else I think about? There's 200 people on my waiting list, and we have done a drop in the bucket. There's so much more to do.
When people say, give me a story, I said, there is no a story, there's all of them are stories.
Yeah, and then we're gonna refer him to infectious disease. And I will be making some phone calls.
After coming in for my first appointment, I was highly impressed, and
It was incredible service, and I was assigned to a doctor that actually wanted to help me out and figure out what was going on. Jared Lambert.
Today we're following up on his treatment plan. I started him on some medications and we're monitoring his progress, and I'm curious to see how he's doing.
A lot of misdiagnosis, a lot of just, oh, it's just this or that, or it's psychosomatic.
It's good to see you.
Good to see you too.
Okay, the big question, how are you?
I'm feeling much better.
Are you really?
I really am. I'm feeling almost back to my old self.
Really?
Still a little bit tired. I'm sure my body's
Right.
still a little bit, you know.
Okay.
Thank you.
You're welcome. Here we go.
Yep.
Good to see you.
You too. And thanks again so much for
Yes.
everything. The approach, all of it, you know.
Aw.
It's a whole.
I'm so happy with this outcome. So after a day's worth of work, I'm emotionally slightly drained. I do go home to 3 tiny children. I think that one of the reasons why I come back here is because at the Noor Clinic we really make a difference. Carrie has been seeing providers and has been back and forth with different diagnosis and lab work, and you know, for over 10 years. Jared also for the last 2 years has been searching for answers as to why he is so chronically fatigued. I was happily surprised that Jared is doing so well. Research that we have, late stage Lyme disease is hard to treat, and there's not a lot of large studies out. Had been thinking about him, you know, almost every day, wondering what this appointment was going to be like. So it was nice to see that his fatigue is gone, his generalized aches are gone. He wants to start exercising and eating well and getting back to his candy making business, and that's everything. That is why I'm here.
I came on down here, and Sheraton, I call her my captain, saved my life.
He was diagnosed with a severe heart condition and atrial fib. Then I get a phone call from Paul, and he tells me he has 1 dose of medication left. That's it. He could throw clots, he could have a heart attack, he could have a stroke if he wasn't on the medication. It hasn't gone through yet with our pharmacal assist program, so we're still pending.
But she had a patient that returned some that was unopened that she could use.
So we also had Thanksgiving holiday coming up, and we were closed.
And she goes out of her way and meets me at the standard gas station on Foothill, risking her life to meet me, to give me Xarelto at the gas station. How many doctors are going to do that? It's unbelievable.
I have to say it did make me feel good. It was very rewarding to see the day that that man came to us, just worried about his tooth, and then everything that we were able to find on him, and just knowing that he's doing so well. I have to say it felt really good. I felt like an angel.
What's the one word that comes to mind when you think of the Noor Foundation?
Grace. Grace. That's what I think about. You know, so many of these people, they haven't been afforded the luxuries and the kindness that we expect and take for granted. I wish, I guess, rather than doing this documentary, no offense, I wish people could just sit behind me a couple of days and just, you know, hear the stories and the challenges and the incredible burden that these people, you know, just have to go through every day. So, you know, I think the grace and kindness is so critical, and, you know, like I said earlier, almost as important as the medical care itself.
Love, truly, yeah, love. I think that we're not only cleaning their teeth and working on their teeth and restoring them, but we're lifting them up and we're giving them hope, and that's very important.
Who would care about you? The Noor Foundation, they do care about you. And you really have that feeling that they do. You don't run into it that often this day and age.
Do I feel like I have answers right now? No. But do I feel like somebody cares and is willing to go down the road and figure it out with me? Yeah. Like, that's all it takes. Just for somebody, like, to feel like somebody cares. And it just completely changes the whole game.
You can talk about the theory of healthcare, and you can talk about whether or not Medicare for all or healthcare for all or what system should work. But in the meantime, while the discussions and the debates go on and more people lose their insurance or their ability to get healthcare, we don't talk about it. We just do it.
Me coming from the business world for 15 years, all I cared about was making money. And coming to this clinic, I felt like the Grinch, how his heart just, was this big and just grew and grew and grew. We actually make a difference here. We actually save people's lives.
He was diagnosed with Hep C and went to what our county had to offer,
right,
which was the Hep C clinic.
That's where I started learning about it all, and then I just kind of got really depressed and
About the price.
yeah, and gave up.
It was still going to be $30,000 for your medication. I knew that I had to do something. I knew that our community was great. I had the support of all the providers here and Dr. Nooristani and the specialists in the community that were willing to help the Noor Clinic, and you.
She don't give up. So who else better could you have in your corner, I don't think anybody else better.
People are good people and they do want to help in this community, so if we can do it, we will. And we did.
Yep. If God gives you a talent and the ability, you got to use it for the good of humanity.
When you can, explain to them, you can tell them these stories about these patients, and other people want to help. And that's the name of this community.
Where do you think the Noor Foundation will be in 5 to 10 years?
I hope it's non-existent. I mean, that's my honest hope of saying, look, you know what? Everybody needs to get insurance. Everybody should have the basic need of having insurance. I don't want anybody to worry about their health care. In San Luis Obispo County, over 20,000 plus people have applied for unemployment already, and that number is growing weekly. One of the major challenges that we're going to face once the doors are open is the number of uninsured patients is going to be significantly higher than what it is now.
I'm concerned that people may be losing their insurance, and so we may really see a spike in the number of people that need the Noor Clinic.